Welcome to Marrow Masters, sponsored by the National Bone Marrow Transplant Link, Insight Corporation, and our esteemed link partners. The National Bone Marrow Transplant Link, established in 1992, strives to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow and stem cell transplants from diagnosis through survivorship. This season of Marrow Masters focuses on chronic graft versus host disease, or GVHD. Here's your host, Executive Director of the NBMT Link, Peggy Burkhart.
Welcome to the Marrow Masters Podcast series. Today we are going to talk about coping with the long-term effects of cancer treatment and chronic graft versus host disease, focusing on the physical and emotional issues. We have with us today Stacey Prieur, RN of the Karmanos Cancer Institute. Stacey, will you tell us a bit about yourself?
So I graduated from the University of Windsor in 1991. I am Canadian, and I came over to Detroit, and my first job, and I stayed at this job, was working for the bone marrow transplant unit. At the time, we were owned by the Detroit Medical Center, and we were called Harper Hospital, but now we are Karmanos and owned by McLaren. I was a floor nurse, and then in 2000, I became a bone marrow transplant coordinator, and I've been working closely with BMT Link and the National Marrow Donor Program, finding donors for patients, whether they're related donors or unrelated donors. And I am a certified hematopoietic transplant coordinator, got my certification through the National Marrow Donor Program.
Terrific. Thank you so much, Stacey. First thing I'd like to ask you about is, do you have any advice regarding finding medical help in a patient's hometown?
Well, I know patients want to go to their hometown for medical treatment, especially post-transplant. It's a burden to drive hours to come to a transplant center. The only caveat with that is most rural hospitals that don't do transplant are not aware of graft versus host disease. So I'm going to give you an example. So we had a patient who lived a few hours away. Instead of coming here for treatment, she decided to go to her local hospital, and she had a skin rash. The hospital didn't know what it was. They thought she was reacting to her medication, so they took her off her tacrolimus, which is her medication to help prevent graft versus host disease and to help prevent rejection. Her stage 1 skin graft versus host disease then became quickly stage 4. She was then transferred to our unit, and it was a big struggle to treat the disease, get it back in control. So I always hesitate when patients want to go to their local hospital. They need to talk to their physician. They need to let their physician know where they live, what hospital they're going to go to make sure that their physician at their transplant center is comfortable with that hospital, that they have a good rapport with the staff there and the doctors, and realize that anything significant, they really need to talk with their physician at the transplant center, even if it's a phone call, because you want to catch that graft versus host disease while it's in its early stage 1 or 2, not when it's in stage 3 or 4.
And how many years later will you still be treating chronic graft versus host disease patients? Is there a rule or a number of years involved?
I would like to say that the longer you go from a transplant, the less chances of chronic graft versus host disease. So as we know, if you get acute graft versus host disease, it's within the first 100 days of a transplant. If it occurs after 100 days, it's labeled chronic. So the further you go from the transplant, I would say your percentage chances of getting chronic graft versus host disease start going down. That being said, unfortunately, we have seen patients that years later get chronic graft versus host disease. So you're never completely out of the woods. You always want to be very mindful. I like to tell patients, you are your own best advocate. So you get out of the shower and you notice a rash on your shoulder that you didn't have yesterday. That could be graft versus host disease. Your bowels are solid and now today they're not. That could be graft versus host disease. I always tell them to over-report. It's better to tell us every little change, every little thing that you notice different about your body. Hopefully it's not graft versus host disease, but do not take the chance.
Very interesting. Can you talk about forever fatigue and the effect it has on patients with chronic graft versus host disease?
I counsel my patients that the biggest complaint that I hear from my patients post-transplant is fatigue. and let them know that it's completely normal. If they used to get up at 6 a.m. and go all day and not go to bed till 11 o'clock at night, that's not going to happen post-transplant. They may need to nap. They may need to nap several times a day. When they get back to work, they may not be able to put in an 8-hour day. They need to really listen to their body. This is totally normal, and it's going to take them a while to feel back to themselves, back to normal. We often say it's going to be a new normal. And I know people hear that term, a new normal. You may never be exactly back to the state you were pre-transplant, but it's a new normal, and you need to really listen to your body.
Absolutely. This makes me think of a story of a patient we had. She loved to make apple pies. When she discovered that her chronic graft versus host disease would not enable her to do this anymore, she and her husband made it one of the things they did together. So it wasn't quite the same. She had her husband help her, and they would do it together. So it became an activity that they could make the pie together, but she also didn't have to give up her love for baking. And I think it's important for people to realize that they will have a new normal, but they can learn ways to work with that so that life is still good.
And I mean, we tell patients your life might not be exactly the same as it was before, but you're alive. You're living. Your disease was not fatal. You're still here. You just have to adapt and learn to deal with the new you.
Absolutely. Could you cover some of the pain that chronic graft versus host disease brings, and maybe some tips for patients on how to better deal with that?
So a lot of times the pain is dependent upon where the graft versus host disease has attacked. For example, if you have chronic graft versus host disease of the eyes, your eyes might be very dry, which can be very painful. We send patients to an eye specialist. There's special eye drops they can use. Sometimes they have to have a cornea transplant, but we make sure we send them to specialists that can actually deal with that problem, and doctors that are aware of graft versus host disease. If they have skin issues, we have a really good dermatologist here who knows how to treat patients with graft versus host disease. When the skin is rashy, sore, tight, sometimes it becomes very tight, almost like a scleroderma. There's different corticosteroid creams that they'll use to help the skin be more pliable. We use photophoresis for patients that maybe the corticosteroids aren't working for. So the doctors here think outside of the box, try to manage the discomfort, manage the pain. Patients that are having difficulty walking, they may have to use a cane, or they may have to use a walker, or even be in a wheelchair for a while until they feel better, stronger, or having less pain. It's just so individual depending on where the graft versus host disease attacks.
And absolutely temporary sometimes. Yes. Maybe it's just going to be a short-term way to get on track and make sure they're getting the rest, of course, that they need. What about the caregivers?
A lot of times the caregivers are the forgotten person. And I always like to tell caregivers, number one, you need to make sure you're well rested, that you're getting respite, that you're getting time away from the patient to be you so that you're rested mentally, physically, emotionally to take care of the patient. It's a huge job being a caregiver, especially with someone who has a chronic illness. And I view graft versus host disease as a chronic illness. You've cured the cancer. They no longer have the cancer, but now they're dealing with another disease. I heard the saying once, you're trading one disease for another. You're trading, say, the leukemia, but now you're dealing with this chronic graft versus host disease. So the role of the caregiver is a huge role. It's so important. And I always tell my caregivers, make sure you get time for you. You may need to talk to a counselor. You may need to talk to a support group with other caregivers, because it can be a very demanding job to be a caregiver.
We hear this all the time, and we have many resources on our website as well, nbmtlink.org, for caregivers and patients. What about meditation? Do you recommend meditation, mindfulness for your patients?
I really believe in the mind and body. I've seen it with patients. I've seen patients who psychologically are so defeated, and even though they should have done great with transplant, because they were psychologically not there, they did not do well. I tell patients, as hokey pokey as it sounds, try to be as positive as you can. I think anything that helps them stay positive, whether it's yoga, meditation, talking to someone at a support group, All of those things really help them to stay focused, to stay centered, if you want to call it that. But it's a hard disease to deal with. And if you're psychologically devastated because of it, if you're feeling hopeless and helpless, that's going to make everything worse. They really need to try to stay positive, and I think all that stuff is wonderful, using medicine and alternative medicine in combination.
What about depression? Do you see a lot of depression because of the chronic graft versus host disease?
Absolutely. Depression, anxiety, and I like to tell my patients, this is situational. So you've never been depressed, you don't have mental illness, but now you're depressed because you have chronic graft versus host disease. You may need to go talk to a psychologist or a social worker. You may need some medication. Maybe you need to be on an antidepressant or an anti-anxiety medication for a while. Not saying that you'll need to be on the medication for the rest of your life, but to get through this hurdle and not to be embarrassed. We're so much more open on mental illness now in our community. And we see a lot of our patients that temporarily need to go on medication.
Makes sense. Absolutely. Is there anything else you'd like to add regarding tips for living with chronic or acute graft versus host disease?
Patients sometimes ask me, what are the chances of me getting graft versus host disease? And no one has a crystal ball. We can't say who's going to get it and who's not going to get it. I had a gentleman who had a perfect match brother, and he got horrendous graft versus host disease. And then I had a lady who had a 6 out of 8 mismatched, unrelated donor, didn't get any graft versus host disease. Maybe in the future, we'll find more clues as to why some patients get it and why some patients don't. But right now, we don't have a crystal ball. So all we can do is try to prepare our patients that this could happen. And if it happens, we're going to deal with it. We're going to tackle it. But I think it's the biggest scare for patients going through a transplant, the thought of getting graft versus host disease. And I don't think we talk about it enough. I think we really need to educate our patients. We don't want to scare them, but we want them to be prepared that this is a risk of transplant.
That is very true. We hear that all the time from the patients that call. Many are prepared, but nationally, many are not. They just really had no idea what this was all about. And they're sad, they're depressed, but hopefully in time, Dr. Steve Pavlatic will say all the time, if you just keep on keeping on, it will dissipate. You will lose most of the symptoms of the chronic graft versus host disease. Do you agree with that?
I do. And I think I put myself in their shoes. So I'm a mom. I've got 2 daughters. If I was faced with a life-threatening cancer and I needed a transplant, even though I'm a nurse and I've seen every form of graft versus host disease, stage 3, stage 4, I would still have a transplant. Because if I could be here for my children, for my husband, to see my grandchildren one day, I would take that risk. I would deal with the graft versus host disease so I could be alive for myself and my family. And I think most of our patients are willing to take that risk. They want to live. They want to live for themselves and their family. And they go, you know what? Without the transplant, I have 0 chance. With the transplant, I have a chance to be cured of my disease. Yes, I may get acute or chronic graft versus host disease, but it's worth the risk. So some people might say to me, Stacey, you're only 50 years old, so of course you would choose to have a transplant. You still have many years ahead of you. But I'm 69 or I'm 75, or like one of my patients, he was 80. But I'm finding more and more older patients are choosing to have a transplant. Even our 80-year-old who we could not find a perfect match donor for, the best we found for him was a 7 out of 8 unrelated donor. So of course the risk of graft versus host disease is going to be increased. And he said, I'm not done living. I want to see my grandchildren get married. I want to see my great-grandchildren being born. I want to go to Italy and visit my family in Italy. I love to cook. I'm not done. He was our oldest patient that we transplanted so far. And a couple of the doctors on our team are like, he's 80, but he was a robust 80-year-old. And, we took him to transplant. And in the summer last year, he went to Italy and he's doing phenomenal. So I think age is just a number. We are healthier at older ages now with advanced medicine. And here at Karmanos, we joke around that we're a geriatric transplant center because we're transplanting more and more patients that are older than 65.
How encouraging and exciting. Well, thank you very much. This was so helpful.
Thank you very much for having me.
This has been the Marrow Masters Podcast. Feel free to share this episode via social media, text, or email. To hear more, subscribe for free to Marrow Masters in your favorite podcast app. To learn more about graft versus host disease and the resources available to patients and caregivers, check out the National Bone Marrow Transplant link at nbmtlink.org. That's nbmtlink.org, or just tap the link below in the show notes.